Hi, James here, and today I'm doing a follow-up video for my kidney transplant. As some of you may have seen my previous videos, I received a kidney transplant back in December of 1999, and this year is going to be my 15th year anniversary, so I'm very excited about that, on December 16th, 2014. So have that to look forward to, very excited, and just wanted to answer some questions I've received from people over the year from my previous videos, and just let people know how I'm doing. So one thing I do want to mention is always double check anything you hear from anyone with either your doctor or your transplant coordinator, because you never know what information you're getting might be incorrect, even from other transplant recipients. Information's changed over the last 15 years, medications are different, techniques are different, so always double check anything you hear. So that being said, let's talk about some of the things that people have asked me over the year. The first thing is about side effects of medications. Again, medications have changed over the last 15 years, so I can only tell you my experiences and some of the side effects I had. They'll probably vary person to person. Obviously, they'll be different, and it all depends on what medications you're on as well. So for me, I haven't had too many bad side effects. A few come to mind. Well, when you first get your transplant, you're on the maximum amount of medication you're going to be on. It's done so that your body doesn't reject the kidney, and then they can determine what the correct levels are for you individually. So they start you off on a maximum amount, and then over time they reduce the medications. And some of the medications you eventually stop taking after about 6 weeks to 3 months. They just eventually you don't take those anymore. And all of those, may have minor side effects here and there. The first one that comes to mind is one of those short-term ones that I think I took for 6 weeks. I forget the name of it, and I maybe don't even use it anymore, but one of the side effects was I had temperature sensitivity in my hands and my feet. So for instance, when I went to take a shower, if I put my hand in the water stream, it felt like it was scalding, even though if I stuck my elbow in to check the temperature, it felt like it was normal, levels of water. So my hands were just sensitive to heat. My brain was thinking it was really hot, but actuality, normal temperature, so it didn't do anything. That side effect went away as soon as I stopped taking the medication. Another one I had was with prednisone, which is a steroid, and I don't know if people still take that. I talked to one patient who apparently doesn't take it anymore. Wasn't prescribed it, so he doesn't have this. But for me, one of the effects was what they call roid rage, where you're just on such high levels that you're very sensitive to mood shifts. And minor things can just make you very angry. So it's important that you if you're on those medications, to let the people who are going to be taking care of you after your surgery, that you may not be the most pleasant person to be around. Another effect, again, that went away as soon as my levels were reduced, and they reduced that one very quickly over time to where I'm barely on any at this point, so it doesn't bother me at all. Another effect of that same medication was what they call moon face, where you put a lot of weight on around your face, either water retention or something, but for some reason your face swells up a little bit, and again that goes away very quickly. So that's gone, after about a month or so. But it starts after like a week or two. I don't know if it's because you're eating more or you're retaining water, but for whatever reason, you get that for a little bit, but it goes away when you lower that medication. Another one I had was with my cyclosporin, where if I was taking too much when they were adjusting the levels, I would kind of have a tremor in my hand, like this is kind of normal, and like I'd sort of have this sometimes, especially if I worked out or did something really strenuous, lift some stuff, then my hands would just have a little bit of a tremor. Wouldn't be all the time. I don't remember if it was cold, if that brought it on a little bit too. Maybe if I was drinking caffeine, I got a little jittery. But again, that's a minor side effect that went away when they finally adjusted my medications to the right level. And you may notice if you're having that, maybe your medication's still too high, and you should probably talk to your doctor. Again, that's just my personal experience. Other medications, I can't think of too many other side effects I had. If I did, they weren't very memorable. It's been 15 years. Ongoing, though, I don't really have any side effects from the medication. Another side effect is, my hair came in darker after the transplant because of the medications. It just grew in a little darker than it was. My hair was a little bit lighter prior to, and I guess maybe it was a little thicker. So there's also that one as well. And another question I received was, do I wear a mask from a person who received a transplant? And again, this depends on, your specific situation, like the area you live, and, what it's like around you, and, if it's flu season or things like that. I personally don't wear a mask at pretty much any time. Maybe if I went to the emergency room or something, I might put on a mask just because there's so many sick people in a concentrated area. But typically, day to day, no, I don't wear a mask in any way. Little doctor masks is what I'm talking about. If I'm out and about and I see someone coughing or something, I'll turn and walk the other way. And I still wash my hands a lot. It's like really good. I think all kidney transplant patients should wash their hands just a lot. So no mask. See, going out to eat was another question I had. Like going to restaurants, is it safe? Again, have to fall back on, it depends on the area you're in and what your doctors are telling you. For me, personally, I do go to a lot of restaurants. I go through fast food, drive-through occasionally if I'm on the road. But, I also look at the restaurant and see what my feelings are. If it's a clean restaurant, I'll feel okay. If it seems a little sketchy or doesn't seem quite clean, I'll probably just turn around and leave and look for someplace better. So that's what I have about restaurants. Again, I have some food exclusions I mentioned previously, such as shellfish and undercooked meat. Some other products, I can't have honey. And grapefruit counteracts one of my medications. And there's probably some others, but I'm aware of them when I go to eat something, but they're not just coming to mind. This year I did have what I thought was a rejection incident, where I went in. As a transplant patient, you should have follow-up visits with your doctor. Me personally, I go in 4 times a year, every 3 months. And they do a blood draw, and you take a urine sample, and then I get the results when I see the doctor. And this year, a few months ago, I had a case where my creatinine level, which is normally between 1.6 and 1.8 for me, had spiked up to 2.2. And of course, I panicked. I was afraid, there's a problem with the kidney. I talked to the doctor. We retested. I set up appointments with my specialist at UCLA. I went in and saw them. The next test when it came back was a 2.0, so it was going down again, which was good. As long as everything kept going down, we were fine. I retested again. It was at 1.89, which is still a little high, but it was almost to my range. And then I retested last week, and it was back to 1.80. So that was great. Back to my normal range again. Don't know why that spiked up. The doctor had a few theories. I'm not sure, if it could have been lab problems. He thought it might have been because of it was really hot, so I might have been dehydrated during those tests. So drink a lot of water. But it's very important that you do follow up with your doctor and have those follow-up checks, just because if anything is going wrong with your kidney, the test will let you know long before you ever feel it. So that's why I was worried, and I think any transplant patient would be very worried if their test results were starting to go higher. But I'm happy to say everything's back to normal. So this year's a good year. I did recently find out there's, I'm not sure if the correct name is like the 25 Club, but it's for transplant patients who have gone over 25 years or more. They kind of like wear jerseys with how many years they have on there for their transplant, like 25 years if you have 25 years, 30 years if you have 30. I kind of want to join that, so I'm hoping to stick around for a long, long time to come. But it's a hope of mine, and I think that's really all I got this year. So I just want to say thank you so much, Sister Gail, thank you so much to my sister Gail for donating the kidney. I love you. Thank you. See you next year. Okay, so here I have shampoo. You may remember from my other video, she's my drug-reminding cat. She's 17 right now. She's going on 18 years old. She no longer reminds me at all to take my medication. She's made me have to do it myself. But she's still wonderful. She, she's totally blind now, and she gets around great. And that's all I got to say from her. You want to say anything before we go? She's shy this time. Good kitty. Okay. Thanks so much, everybody. Bye.